We do have one drug on the market already that is called flibanserin, and it was approved a couple of years ago now for low sexual desire. It works through different brain chemicals than the bremelanotide. Flibanserin works on the serotonin and dopamine brain transmitters, whereas bremelanotide is working on melanocortin. Both of these drugs are working on increasing those brain chemicals that are excitatory and reducing the chemicals that are inhibitory. Now, bremelanotide is just working on the excitatory end with melanocortin, and flibanserin is working on decreasing serotonin, which is inhibitory, and increasing dopamine, which is excitatory. So these are all brain chemical type medications. This is not the female Viagra, and it's sad that we continue to reference everything in terms of a male drug equivalent, but no, whereas Viagra affects blood flow, these drugs that are approved for sexual desire in women, both flibanserin and bremelanotide, affect the brain neurochemicals. They're not about the arousal aspect. This medication empowers a woman to sort of be in control of her sexuality then. So if she is bothered by low sexual desire, and by that I mean it causes distress, so that could be a sense of disappointment or guilt associated with not being sexual, or a relationship problem, but it's bothersome, it's frustrating for women. So this empowers her to be able to change that and put her sexuality back in her own control. A good candidate would be a premenopausal woman in whom we cannot identify any other treatable cause for low sexual desire. For example, another medication that's causing a problem, or sexual pain that's a problem and causing low desire, or a relationship issue, which should be addressed in other ways, of course. In the studies that led up to the FDA approving the drug, we note that about 40% of women will have some nausea, and about 20% of women will have some flushing. Now, this is a little different from the other drug, flibanserin, in that it is given by injection on demand. So that means it's not used as a daily drug, it's just used when the woman wants to have sex. And then she would inject the drug about 45 minutes before planned sexual activity. So low sexual desire is the most commonly reported sexual problem in women. And keep in mind that about 44% of the female population reports a sexual problem. So low sexual desire is the most common of those. And even when you say, okay, not just including the women who report a problem, but the women who are distressed by that problem, it remains the most common sexual problem in women of all ages. There is the sociocultural category, so that's how much sex education did we have? What did our family of origin teach us about sex? What does society and religion teach us about sex? And then the final category is the relationship category. So how is the relationship with the partner? Is there good communication? Does the partner have sexual dysfunction? Are they in the same place at the same time? So logistics. So there are a number of factors that really contribute to sexual function or poor sexual function in women.